Malik, intensive care specialist. About 2 weeks back, we got an young individual, about 18-year-old boy, who came to us to ICU around 6 o'clock in the morning with inability to breathe, breathlessness. He was unable to breathe. He was conscious. He's speaking. He's talking. Though it is low voice, he's talking, but he's unable to breathe. So immediately we had to, the oxygen saturation is falling. So we had to put him on ventilator immediately. And the patient, once we stabilized the patient, I called the father and I started asking what exactly happened. The father told us that exactly 2 weeks back, prior to this problem, 2 weeks back, he had some respiratory infection. He had throat pain, some lung infection. He got treated for this, and he had also some few motions, loose motions. So after this, there was nothing. Exactly after 10 days of suffering, he developed some tingling numbness in the lower feet. The ankles were little weak. Slowly there is weakness of the lower limbs. He was walking with difficulty, and after 1 or 2 days, he was unable to walk. He was taking. Previous night, he said, yesterday night, father had to help him to go to toilet. Okay, father felt there is something abnormal. He wanted to take the boy to the neurophysician next day morning. So suddenly, early morning at 4 o'clock, the boy became breathless. He is unable to breathe. That means the paralysis of the lower limbs is slowly spreading upwards. First foot, ankles, and slowly spreading upwards. That paralysis has come to the diaphragm. Diaphragm, you all know, it's a layer which separates our chest from abdomen. There is a layer. So diaphragm got affected. Later, the intercostal muscles, the muscles between the ribs, they got affected. Muscles between the ribs got affected. So he is unable to breathe. These are all called muscles of respiration, accessory muscles of respiration also we call it. So the boy is unable to breathe. That's how he was brought to the hospital. This is called GBS, Guillain-Barré syndrome. That means it is bilateral. It affects both the sides of the body. Why is it caused? What is the pathology? It is usually the upper respiratory tract and our infections, throat infections, respiratory infections are by some bacteria, sometimes Campylobacter, and sometimes the motions, the loose motions on wall can be because of cytomegalovirus. These two are usually reported in this particular condition. The antibodies which are produced by our body to combat these viruses, because antibodies are produced by the body to kill the bacteria or the virus. After the disease process is over, suddenly what happens, these antibodies are left over in the body. They start acting on our own nerves, particularly the myelin sheath over the nerve. Every nerve has got a myelin sheath. So these antibodies are acting over the myelin sheath. So our own antibodies produced by our own body are acting on our own nerves. This is how the pathology occurs and causes paralysis of the nerve. The nerve supplies the muscle. So paralysis of the muscles. So it is slowly coming upwards. The boy is kept on ventilator and he received treatment and also not only the nerves. Not only the nerves are affected, spinal nerves or cranial nerves or whatever nerves, it involves the autonomic nervous system also. Autonomic nervous system, there is one nervous system in the body apart from the spinal nerves called sympathetic, parasympathetic. This is called autonomic nervous system, which controls our heart rate, everything. Our heart rate, everything is controlled by autonomic nervous system. So because the antibodies are acting on the autonomic nervous system also, there is sudden BP rise, there is sudden BP fall, there is sudden heart rate that comes down, heart rate suddenly goes up. All these disturbances occurred in the boy also. In this boy, already all these disturbances occurred. Then the treatment started. The patient was on 3 days to 4 days he was on ventilator, and we have given IV immunoglobulins. IV immunoglobulins we have given. Then actually there is another treatment called PLEX, that is plasma exchange. That is in higher centers only. We could not do that. We have given IV immunoglobulins, and the patient recovered after about 3 to 4 days. The fourth day we have removed the ventilator. The patient was here for 10 days. He received the total treatment and he has totally recovered. He has totally recovered. Absolutely, there was no problem. The patient in this condition, in this Guillain-Barré syndrome, 70% of the patients, they recover completely. They recover completely. And some rare presentations also we have seen, like not exactly Guillain-Barré syndrome. Some rare conditions we have seen in for some time. After respiratory infection, suddenly the eye nerves, optic nerve is affected on both the sides. The vision is impaired. The vision has come down, dullness in a young boy. He was an IT professional, and we have sent him to a neurophysician. Then about 6 weeks he was on some steroids or something. He has improved. After that he has become normal. And one more case we have seen after respiratory infection, suddenly the right shoulder to right hand, there is some amount of only one side. There is completely, the hand he is unable to lift the hand. It's almost like a semi-paralysis. So this also occurred after respiratory infections. These are not concerned with Guillain-Barré. Guillain-Barré syndrome is completely bilateral. It affects both the sides of the body. But these are rare presentations, some people have told us. But all these come under neurophysician. But completely in about 10 cases, 7 people completely improve and go home. There is no problem with this case, but we have to understand that these problems do occur and they need immediate attention.